Hi, Dr. John Torres here from NBC News with my Daily Doc, where a couple times a week I go over headlines for the week. I talk to you about the headlines, give you some information about what they actually mean, because sometimes the headlines themselves can be a bit confusing, but get to the story, the meat and potatoes of what it means, and particularly what it means for you, your community, your loved ones, your family, and trying to give you some information you can go away with. It can help you, again, your loved ones, your family, your community, get through this pandemic sooner rather than later and as healthy as possible. And then I answer questions. So if you have questions, please send them my way. That way I can go ahead and answer them as best I can, and as many of those as I can. But going over the headlines, first and foremost, the biggest headline of the day, and this just came out an hour and a half ago, the CDC released what they're calling their interim public health recommendations for fully vaccinated people. And this is something they talked about last week that they're going to start pushing out there. They're going to get these information out. This is what they're calling interim, which means it's the first step. And in a briefing today, they said over the next few weeks, we're going to get more and more information. But we now have more information about what it means to be vaccinated, and particularly what it means that you can do, because this is what people have been asking. They've been saying, wait a minute, I got my vaccine. Doesn't that mean I can do more things? You know, let's go ahead and tell us what we can do. And they want to give some very specific things, and particularly not just general recommendations, but specific recommendations for you and your household. So here are the big ones they came out with. First and foremost, they say all these recommendations are based on you becoming fully vaccinated. And by fully vaccinated, what they mean is 2 weeks after your last dose of whatever vaccine you're getting. So if it's Pfizer or Moderna, 2 weeks after that second dose. If it's Johnson & Johnson, it's 2 weeks after the single dose. That's when your immune system is as robust as it's going to be based on that vaccine and can fight off the virus as best as it can here at this point. Once you get to that point where you're fully vaccinated, here are their guidelines. And what they're saying also is you have to remember, these do not completely eliminate risk. These just lessen the risk. And the risk is very small if you're vaccinated of you getting COVID and you getting any kind of serious illnesses or serious complications from COVID. So the biggest risk are to those who are unvaccinated. And they made sure they made a point of that. But here are the guidelines, 3 specific guidelines. One, they said you can visit, I'm going to read it off of their release here. They said visit with other fully vaccinated people indoors without wearing masks or physical distancing. So you can visit with other people inside who've also been vaccinated, again, fully vaccinated 2 weeks after that last dose, indoors without wearing masks or physical distancing. So, you know, those hugs we typically give each other when we greet and stuff like that, if everybody's fully vaccinated, you can do that. This is probably the biggest step they took here, and this is point number 2, and this answers the question I have been getting since I started doing Facebook Live. I'm a grandparent. When can I visit my grandkids? I want to give them a hug. I want to sit them in my lap and read a book to them. When can I do that? They're answering that question. Here's what they're saying. Visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing. And that can be a bit confusing. But what they're saying is you can visit with unvaccinated people inside. If they're from a single household, you're from a single household, you can visit with them indoors without masks, without social distancing, if nobody in that household has risk for complications from severe COVID disease. So again, that's one of their caveats. Everybody has to be low risk in that household, but even if they're unvaccinated, you can bring them into your household, you could go to their household, and you could gather together without masks or social distancing. So that answers the question. As a grandparent, if you're fully vaccinated and you have grandchildren who are not fully vaccinated, you can visit them or have them visit you. You can hug them. You don't have to wear masks, at least at this point. But they also say here, which I think is an important point, if you are exposed to COVID, you do not need to be quarantined. You do not need to test unless you start developing symptoms from COVID, because the risk is so low. But there are a couple points they do make. Number one, they do say that these are basically active considerations for those who have been fully vaccinated, safe considerations, but the risk is small. And the risk is more for people who have not been vaccinated. So if you're together, the risk is for those who have not been vaccinated. So that's why they're saying if the grandchildren or anybody in that household is at risk for severe disease from COVID, then they need to be careful with that. This is initial guidance, what they're calling just a first step. And these guidelines are essentially put up for things happening in private settings. In other words, your household, because they are still recommending a few other things. when you're in public, you still need, even if you've been fully vaccinated, you still need to take the normal precautions. Social distance and wear a mask. Don't go in large groups. Avoid unnecessary travel. Those are the same recommendations we've been following for months on end. And they're saying, yes, we still need to follow those even if you've been vaccinated because the herd immunity level isn't there yet. What they mentioned today is because based on the vaccines, we are a little over 11% people vaccinated. I'm sorry, we're a little under 10% of people being vaccinated with both doses, fully vaccinated at that level right now. We need 70 to 85% for herd immunity. We're a little under 10%. And so we still have a long ways to go. But again, going over those very briefly here, 3 things. 1, you can visit with other fully vaccinated people indoors without wearing masks or social distancing. 2, you can visit with unvaccinated people from a single household indoors without wearing masks or social distancing if nobody in that household is at risk for severe COVID complications. And that means obviously, grandparents can meet with grandchildren. And if you do get exposed to COVID and you're fully vaccinated, you don't need to quarantine or test unless you start developing symptoms. This is great news, and this is what we've been looking for because people have been saying, I'm getting my vaccine. What can I do now? What kind of things? And hopefully this gives some people an understanding that getting them a vaccine is going to start opening up their lives a little bit more. They can start doing more and more things, and hopefully that'll encourage more and more people to get the vaccine. We'll see. And as they're saying, as more and more people get vaccinated, as we get more information, we're going to go ahead and change these guidelines over the weeks and months to come. So we'll certainly keep an eye out for that, and I'll let you know once those things start cropping up as well. But for now, this is fantastic news. And so if you have friends or family that have been fully vaccinated, you've been fully vaccinated, and you want to bring them over for dinner, fantastic. Now's the time to do that. Now's the time to start getting those social connections back again that can help us not just with our loneliness and our isolation, but with our mental health as well, and start doing those things that we've wanted to do. But again, these are baby steps. More steps will come as weeks go on and as more people get vaccinated. So hopefully we'll start getting closer and closer to that herd immunity. Still have a ways to go, but hopefully we'll get closer. So that's headline number 1. Headline number 2 is some information about, over the last week or so, there have been questions about should we give people 1 dose, and then that way we can have more dosing out there for more people, and then not necessarily give them that 2nd dose. What the experts are saying is no, we shouldn't be doing that. We should make sure people get the double dose they need if it's Pfizer and Moderna. And again, Johnson & Johnson is a single dose, but get both doses because that's the way the human trials were set up. That's the way the vaccines were tested in these human trials. And we really don't know with single dosing. We know they can be effective. We don't know how effective they can be and for how long. And that's probably the main thing. But we do know with the double dosing for Pfizer and Moderna, it can be effective, it can last a while, and that's where they're saying, the experts are saying we need to go with. So even though it sounds like a great idea on paper to go ahead and split the dosing so you only get 1 dose and other people get the other dose so that way we can get more people vaccinated, we need to make sure people are fully vaccinated. And we're getting more and more vaccines, we're getting more and more people vaccinated. We still need more and more people to step up to get vaccinated and more people to step up to help give the vaccines. And so we're working those out. Those are getting, the process is getting much smoother as time goes on. And then the last one I want to talk about is the vaccine effectiveness. And because there's been a lot of confusion about what that means, because Johnson & Johnson got its emergency use authorization, its effectiveness was deemed to be 72% effective here in the U.S. And that's what people heard, that's 72%. And they compared that to the 94, 95% from Moderna and Pfizer. But you have to realize those numbers are different. The studies were done differently. They were analyzed differently. Johnson & Johnson studies were done in the midst of some of these variants, particularly in South Africa, and showed good effectiveness against the South African variant. But at the same time, they measured things differently. And so it's comparing apples to oranges. You really can't compare that number. But I'm going to give you a number you can compare. And this is why I want to talk about it. All 3, even though Pfizer, Moderna, and Johnson & Johnson looked at different outcomes, looked at things differently when they looked at their effectiveness, there is one thing they looked at, all 3 of them, and I can give you those effectiveness numbers. They looked in their human trials after people were fully vaccinated, again, 2 for Pfizer and Moderna, 1 for Johnson & Johnson. After they were fully vaccinated, they waited that 2-week time period, and particularly 28 days for the Johnson & Johnson after getting vaccinated. Once they were fully vaccinated, what they found is that nobody who was fully vaccinated in these trials, and we're talking over 50,000 people combined in these 3 trials got fully vaccinated, none of them were hospitalized, none of them died from COVID. So essentially, all 3 looked at the effectiveness of the vaccine keeping you at a hospital and keeping you from dying of COVID. And in the trials, the effectiveness was 100% for Pfizer, 100% for Moderna, and 100% for Johnson & Johnson across the board, all three. Now, does that mean it's going to give you 100% protection from hospitalizations or COVID? No, but at the same time, it means that in the trials, they showed a very, very high level of effectiveness. And so it's very good at keeping you from being hospitalized or from dying from COVID, which at the end of the day, is one of the bottom lines we look for. So again, going over the headlines, great news from the CDC, recommendations on what we can do now that we're fully vaccinated. And so as I've been telling grandparents, you've been wanting to see your grandchildren. If you're fully vaccinated, now is a great time to do it, assuming they're low risk from COVID or their family members are. Number two, looking at the 1 versus 2 doses, we need to keep with what was done in the human trials, and that's 2 doses for Pfizer and Moderna. And then number 3, the vaccine effectiveness. Looking at those numbers, 72% versus 94, 91%, those aren't the numbers to look at. Instead, look at the numbers of how effective those vaccines were at keeping you out of the hospital and keeping you from dying from COVID. In the human trials, they were 100% effective, all 3 of those vaccines at doing just that. So now let me see if you have any questions.
Is it safe to travel after getting the vaccine?
So the question is it safe to travel after getting the vaccine? And the CDC actually answered that question both in what they recommended and in their press briefing. And what they said is that you want to avoid any unnecessary travel because we still need to do everything outside our house like we normally would. What these recommendations are, and I want to make sure I'm clear on that, what these recommendations are what you can do with your individual household and other individual households. And so if both households are vaccinated, can certainly get together. If this household's vaccinated, as in the grandparents, and the grandchildren's household is not vaccinated, you can get together as individual households. But general public-wise, you still need to take all the same precautions, all the same measures. Masks, social distancing, avoiding large groups, avoiding unnecessary travel, those things that we know can keep things under control until we start getting higher levels of immunization. And like I mentioned, they said that we're a little under 10% of people getting fully immunized at this point, adults. We're going to be getting there eventually, but right now we need to make sure more people get vaccinated before we end up doing that.
How soon after having COVID-19 can I get the vaccination?
And this is actually a really good question. How soon after getting COVID-19 can I get the vaccination? And there's a bit of confusion here because of what the CDC came out with a couple months ago. Bottom line is, after getting COVID-19, once you recover from COVID-19, you can get the vaccine anytime after that. Again, once you recover from COVID-19. And this is like any type of illness. If you're sick, as in you have fevers, then you need to wait until that illness is resolved before you get this vaccine. Part of the reason is because the way your immune system works. You want to make sure your immune system isn't still actively trying to fight off this active infection while you're trying to get a vaccine, because it really can't do both things as well as it could one at a time. And so you want to make sure that COVID is resolved. Once it's resolved, you can get the vaccine. Now, here's where the confusion comes in. A couple of months ago, the CDC said, we know that after you recover from COVID, for 90 days, you have some protection from getting COVID again. 90 days, 3 months, you have some protection from getting COVID again. So if you want to step aside, and remember, this is a couple of months ago, back in January, when we were still having problems getting the elderly and those high risk of getting the vaccine, they said, if you want to step aside, so somebody who's at higher risk can get the vaccine, you can do that, but you can only do that for 90 days. Once you get to that 90-day period, you need to get vaccinated. So the bottom line is, as soon as you recover from COVID, you can get vaccinated, and you should get vaccinated, especially at this point where the vaccine is becoming more available, and certainly over the next couple of weeks when it becomes even more and more available. But you definitely want to make sure you do it within 90 days if you're in phase to get the vaccine of recovering from COVID.
Does taking antibiotics in between the 2 vaccine doses lower the effectiveness of the COVID vaccine? So
it's a great question. Does taking antibiotics lower the effectiveness of getting the vaccine? And in particular, they're asking about taking antibiotics in between the 2 doses. I'm assuming that in between the 2 doses, somebody ended up getting sick, getting put on antibiotics. The answer is, for the antibiotics themselves, no. If you're on antibiotics, you can still get the vaccine. It will still work as well and be as effective. unless you're actively sick at that time, meaning you have fevers and you're actively sick. Here's the example I can give you because this can cause a little head scratching. Let's say you have strep throat. And as a doctor, I put you on antibiotics for strep throat. You have all the symptoms of strep throat. You have fevers. You're on antibiotics for 10 days. Let's say 6 days in, you start feeling a lot better. You don't have any more fevers, but you still have 4 days of antibiotics to go. Well, your illness has resolved. We're just trying to make sure we kick all the bacteria out. So we have 4 more days of antibiotics. In that 4-day period, even though you're on antibiotics, but you're not actively sick, you can go ahead and take the vaccine. And the same goes if you're taking antibiotics for acne or anything else like that. That's kind of a more chronic condition, but you're not actively sick. You can take the vaccine. It's not going to interfere at all with each other because they work on 2 different mechanisms. It should still give you that robust response we're looking for. So yes, if you're on antibiotics, as long as you're not actively sick, and by that I mean particularly have fevers, then you can go ahead and get the vaccine.
Are the vaccine studies available to the general public to check out?
The vaccine studies are available to the general public to check out. You do have to do a little bit of legwork. You can go to the FDA, where they're the ones that gave the emergency use authorization. There's information there. You can go to specific manufacturers. There's information there as well on the actual trials themselves and some of the data they came out with. So yes, it's available to the general public. The one nice thing about this emergency use authorization, this dates back to December when they were getting the initial ones on the Pfizer and Moderna vaccine, is all this information has been made public. In the trials, in the emergency use authorization themselves, you can, if you want a full day's worth of discussion, you really want to get in depth, you can watch the emergency use authorization. Those are all online. And you can actually watch the VRPAC meeting, which is the one that's going to give you the most information. And VRPAC is that Vaccines and Related Biological Products Advisory Committee. If you look at that, for all the different vaccines, they met the day before the emergency use authorization was authorized. They met, full day of discussions. These are numerous scientists, 20-plus scientists, researchers who sit down and they just talk among themselves and discuss the various points that came up in the data. So if you want an in-depth analysis and you have a day to spare, you can watch the VRPAC meetings and they'll give you all the analysis you need on this and all the information. Everything has been extremely transparent. So yes, you can get all the information. Again, you need to do a little bit of legwork, but you can certainly find it.
Why does the CDC ask what race I was before getting the shot?
So the question is, why is the CDC asking what race I was before getting the shot? It has nothing to do with the vaccine and how it works. What it has to do with are the statistics behind the vaccine, and particularly right now, one of the big pushes is to make sure that the Latino community, the Black community, some of these underserved communities that typically don't get access to these vaccines or these medicines, as well as other communities, are getting the vaccines and the medicines that they need. And so they're trying to make sure they get the statistics, because in order to understand which communities are not getting it, they need to understand which communities are getting it. And so that's the simple reason they ask you that. It has nothing to do with the effectiveness of the vaccine. It has more to do with making sure that equality is there, as far as making sure that we get this vaccine to the communities that really need it, and not just to communities that have easier access to it.
I know mRNA vaccines are new. How new are DNA vaccines? What's the difference?
So the question is, mRNA vaccines versus DNA vaccines. What's the difference, and how new is one vaccine over the other ones? So the DNA vaccines have been around longer, and the DNA vaccines have been used for a variety of different other illnesses out there. The difference between the two, and it's a bit complicated, but the difference between the two is the mRNA vaccine, it uses, all this comes down to what we call transport mechanisms or vectors, ways they can get what they need into your body so your immune system can react. mRNA vaccines, even though this is the first one that's gotten emergency use authorization or approval, but in this case emergency use authorization, Pfizer and Moderna, they've been in the works for 3 decades or so. And I actually talked to an expert a few months ago on my Doc to Doc series and asked him that specific question. You know, people are concerned because this is new technology. And he said, John, this is not new technology. This is technology we've been working on for 3 decades. For 30 years, this just happens to be the first one that we got to the emergency use authorization process. So the way this works is it gets that mRNA material inside a capsule of what's called polyethylene glycol. So it gets it inside that capsule. The reason it does that is because once it gets into the muscle, it needs to get to the cell. So what happens is that polyethylene glycol capsule gets to the cell, it basically opens up and lets the mRNA get into the cell. Once the mRNA gets into the cell, it stays in the cytoplasm. So not the nucleus, but the cytoplasm of the cell. And what it does is it starts transcribing. The cell starts transcribing what's on there. When it starts transcribing it, it basically is making spike proteins, which are, if you look on the actual virus itself, the coronavirus, these spike proteins are the one it makes, because these spike proteins are what the immune system is looking for. So it makes these spike proteins, not the virus, which is inside the cell, but the spike proteins, which are benign parts of the virus, but they're the parts that the immune system looks for. Once it gets these spike proteins made, it goes out into the body and it keys the immune system to look for those. And then you get a booster shot after that that keys the immune system to build up antibodies for it. With the Johnson & Johnson vaccine, it does both. That's the mRNA vaccine. The DNA vaccine, what that does is something similar, except for instead of using that polyethylene glycol capsule, they use a virus particle. In this case, it's adenovirus. And adenovirus is a virus that can cause cold, the common cold. And depending on which vaccine it is, sometimes they'll use one that is, like in case of AstraZeneca, it's a chimpanzee adenovirus, so it won't even really affect us, even though it gets into our cells. And sometimes it's a human adenovirus, but one that they have basically toned down so it can't give us the infection. Inside they put the DNA. What that does, that gets into the cell, gets into the nucleus, and it can't duplicate itself. It can't ingrain itself into our DNA, but what it can do is it can do a similar thing to the mRNAs, where it starts the cell process of developing those spike proteins. And once it develops those spike proteins, our immune system can go ahead and activate that. That basically is something that's been around longer than the mRNA ones, the DNA ones. But at the same time, they both prove to be very, very effective. And so these are, the nice part is going forward, both of these methods can really make sure that vaccines are produced in a timely fashion, because if these crop up again, we need to be able to make sure we can change things very timely. If these variants start popping up, we need to make sure we can change that, the booster shot to basically start targeting the variants. And so these are great technologies in order to be able to do that. But thank you so much for your questions. These have all been great. And to go over the headlines again, I'll go in reverse order. Vaccine effectiveness, instead of looking at that 72% versus 94% or 95%, that they talk about effectiveness of preventing COVID itself, I want to tell you about the effectiveness of preventing hospitalizations and death from COVID. And all three of the vaccines, Pfizer, Moderna, and Johnson & Johnson, in human trials, and again, there's over 50,000 people got the vaccines. None of them were hospitalized. None of them died from COVID, which is, in the trials, 100% effectiveness. From 100% effectiveness at preventing hospitalizations, 100% effectiveness at preventing deaths. Now, this doesn't mean that it's going to get to that level in everybody, but at the same time, it shows that it's a very, very high level. The other headline was about 1 versus 2 dosing. Some have been saying we should split the dosing. You only get one and somebody else can get the other one. That way we can get more people vaccinated. Experts across the board are saying no, we need to make sure that you get the dosing the way it was set up in the human trials. And that means 2 doses for Pfizer and Moderna, 1 for Johnson & Johnson. And then finally, the CDC came out with their interim public health recommendations for fully vaccinated people. Something we've been waiting for a while, to give us an understanding of what we can do when we're fully vaccinated, and hopefully give other people an understanding that, hey, if I get vaccinated, I can do more of these things. And they had 3 specific recommendations. And again, these recommendations are set up on what you can do if you've been fully vaccinated. And by that, we mean 2 weeks after getting your last vaccine, whether it's Pfizer or Moderna or Johnson & Johnson. 3 things. You can visit with other fully vaccinated people indoors without wearing masks or social distancing. Number 2, you can visit with unvaccinated people from a single household who are at low risk of COVID infections and complications without wearing masks or physical distancing, as in grandparents can visit with grandchildren or vice versa. And you can refrain from quarantine and testing following a known exposure to COVID-19 if you don't develop symptoms. Fantastic news. As time goes on, we'll know more and more understanding of more and more things we can do once we're getting vaccinated. But if you need an excuse to get vaccinated other than, helping yourself and helping your community, this will hopefully give you an excuse as well. So again, thank you very much for listening. I hope you have a fantastic week. And as I always say, I hope this information helps you. And particularly, I hope you, your family, your loved ones, your community stay as healthy and as happy as possible. Thanks.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.